So here we are going to learn few information about the herbal medications. Sometimes we called natural alternative medication, and also the natural alternatives implications. Here herbal remedies are name and uses, and also we are going to talk patient education and how they work. The first one is aloe vera. Aloe vera we use for anti-inflammatory effect for any kind of burn patient, abrasions, and aloe vera helps with tissue injuries. So what are the medical implications? If ingested, may causes GI upset. GI upset not a big issue. Patient may be present with diarrhea, vomiting, and nausea. Also may causes digoxin level get increase. So if your patient take the digoxin, you have to inform them. So next one here, echinacea. Echinacea is blood purifier that fight against the cold, infections, and cancer. So if you ask me how it works, they prevent the cold and flu, and that has immune boosting function. So echinacea has a immune boosting function. Okay, and echinacea can cause the liver toxicity, particularly the patient who have a renal problem. Right? Let me recap it. Echinacea can cause liver toxicity in renal patients and not effective with HIV positive patient. What are the medical implications? Also, patient teaching. We educate them avoid if they have any known allergy to echinacea, contraindication in breastfeeding women and also children, and also immunocompromised patients. Means if any patient diagnosed by cancer and undertaking medication, chemotherapy, or HIV positive patient, they're immunocompromised. They're not good candidate for echinacea. Next one here, ginseng. It is Chinese natural alternatives. Ginseng we use for anemia, hypertension, and benign prostatic hypertrophy. Sometimes board asks which herbal is good for benign prostatic hyperplasia, or question asks what are the indication of ginseng, like we can use it for benign prostatic hypertrophy or hyperplasia or hypertension and anemia. So how it works? Ginseng increase the physical stamina basically, and also reduce the tinnitus or ringing in the ear. So what are the medical implications? When patient use the ginseng, they have to use some caution with high blood pressure, hypertension, diabetes, and clotting disorder. Also avoid with coumadin, right, and may increase the effect of stimulant and hold for 7 days before surgery. So if any patient need to go for any kind of surgical operation, we educate patient to hold ginseng at least 7 days before, right? So ginseng can cause hypertension when mixed with caffeine. So caffeine and ginseng together is not good. And also ginseng increase the risks for bleeding. If patient take anti, um, coagulant or blood thinner, it is important to know. Next medication here, it is St. John's wort, right? St. John's wort basically treat the depression and anxiety. What are the indication? Wound healing, menstrual disorders, diuretics, and depression. But basically, St. John's wort treat the depression and anxiety. So, what are the patient teaching? It is important let your patient know avoid sunlight if they need to take St. John's wort. It is antidepressant effect. Avoid with hypertension and with immunosuppression, right? Avoid food containing theramines and decrease the effect of coumadin, right? Coumadin is a blood thinner. So St. John's wort interact with SSRI, serotonin, selective serotonin reuptake inhibitor, and can cause the sun sensitivities, means photosensitivities, and decrease the effect of coumadin and also decrease the effect of digoxin, right? Very important for NCLEX board exam. NCLEX board frequently asks this question, which one you cannot use with SSRI? Answer is St. John's wort. Which one you will not use with digoxin? Answer is St. John's wort. Which one decrease the effect of coumadin? Answer is St. John's wort. Next drugs is kava kava. Kava kava decrease the anxiety and stress. So the action or kava kava treat insomnia and muscle pain, right? And patient education increase the effect of barbiturate. Barbiturate used as an anti-anxiety or tranquilizer. So kava kava decrease Parkinson's disease medication. Also, kava kava can increase the risk of suicide in the patient with depression. So, who have depression, it is good not to give kava kava. And another natural alternatives, it is called ginkgo biloba, right? Ginkgo biloba, so many people's students can use to improve the memories. They believe if they take it, their memory will boost up. So improve the blood circulation, improve attention span, and also it should be take 6 to 8 weeks to see the result. So after take, you have to wait to get the effect, right? So what are the patient teaching? Ginkgo biloba contraindicated in patients or pregnant women and also children. Avoid coumadin, means blood thinner, right? May increase the bleeding. Increase the effect of monoamine oxide inhibitor. Avoid dilantin, and also hold 36 hours before surgical operation, right? So ginkgo biloba thin the blood So if my patient take blood thinner like coumadin, warfarin, it is good to avoid because ginkgo biloba has the effect of thin the blood. And do not take with warfarin and do not take with aspirin with ginkgo biloba. So ginkgo biloba can interfere with seizure medication as well. I want to recap it. If your patient need to any kind of surgical operation, at least hold 36 hours before surgical operation. Next one is ginger, right? So ginger we use as a vegetables in the kitchen. So ginger has some properties. They relieve the nausea and vomiting. So reduce the morning sickness and nausea and used to treat in case of burn patient. So ginger may cause central nervous system depression, cardiac arrhythmias, contraindicated with gallbladder disease. So if anybody has a cholelithiasis, cholecystitis, it is good to avoid. May increase the bleeding with blood thinner like coumadin or warfarin, and use with cushion with diabetes mellitus, antihypertensive, and also cardiac medications. So ginger do not take if the history of deep vein thrombosis. Also ginger interact with blood thinner. This is the note we could learn from here. Next one is garlic. Garlic also we use as a vegetables. Garlics basically lower the blood pressure and lower the cholesterol. So garlic has a good properties, right? May decrease the cholesterol in the blood and decrease the blood pressure and also glucose level. So you see, if anybody have high blood pressure, high blood sugar, high cholesterol, garlic is best for you. And also have antibacterial effect, antifungal properties. And garlic may improve circulations, right? So what are the note may affect the blood clotting. So they interact with warfarin and interact with aspirin. Is good. If your patient take blood thinner, avoid garlic. Avoid diabetic medication or may increase bleeding with coumadin. As I told you, interact with blood thinner, coumadin, warfarin, and aspirin. And it is good to hold for 7 days before surgical operation, right? And next one, so palmetto. So I got one question in my NCLEX board exam. So palmetto, what are the indication? We use so palmetto for prostate health, benign enlargement of prostate. So palmetto support health of prostate and improve the urine flow. So used for prostatic health, benign enlargement of prostate. They have an anti-inflammatory effect and also prevent the hair loss. So, so what are the patient teaching? No drugs interaction may cause stomach discomfort. So salt palmetto reduce the absorption of iron. This is important. And also risk for false positive prostate-specific antigen test, right? And also, so palmetto will have a diuretics effect, means improve the urine flow, diuretics effect. Next one here, it is Valerian road. Valerian road claims neurosystem, also promote the sleep, used for headache, anxiety, and also nervousness. Valerian road may increase the sedations when used with ethyl alcohol, barbiturate, sleeping pill, and also benzodiazepines. And next groups of drugs here is black cohosh. Black cohosh treat the menopausal syndrome. So used to menstrual disturbance or menopause syndrome, used for sedation and diuretics, and reduce the blood pressure, hot flashes. So sometimes cutaneous blood supply increase in the face and patient has a hot flashes, it reduce night sweat and mood change. Black horse, if any patient need to take, you have to educate them. Black horse overdose may causes nausea and vomiting, headache, dizziness, also feeling tremor and reduced heart rate. Black cohorts contraindicate with chronic heart failure and pregnancy. Affect use of hormone replacement therapy, contraceptives, and cardiac medication. So black cohorts can be used to treat hot flush. This is the question NCLEX would like. But black cohorts contraindicated in pregnancy and will cause premature labor. This is important. Next one is the feverfew. Feverfew used to migraine headache and also for arthritis. Increase the effect of Coumadin and contraindicated in pregnancies, right? So also another one is called Licorite, used to peptic ulcer, GERD, it is gastro GERD retardation, and also weight loss, eczema, and cancer sore. And contraindicated heart disease or may cause blood pressure, and avoid SC inhibitors, avoid with steroid and digoxin. So before to finish, I want to tell little bit more. If you feel it is too much for board exam, at least you have to know which herbal need to hold before any kind of surgical operation. Right here, garlic holds 7 days before surgery. Ginkgo biloba 36 hours before surgical operation. Ginseng hold 7 days before surgery. Also, you have to know what herbal medication is not good during pregnancy, or if mother is feeding the breastfeed to the baby, they have to avoid. Okay, like black horse, like feverfew. So general patient education or teaching. So all herbal medication that start with, again, let me listen carefully. All herbal medication that start with the letter G, okay, like garlic, like ginger, like ginkgo biloba, like ginseng, okay. So all herbal medication that start with the letter G, they are thin the blood or blood thinner. So do not give with warfarin, aspirin, and heparin. Also, all herbal medication are contraindicated during pregnancy and lactations. Herbal medications should be stopped 2 weeks before surgical operation due to possible interaction with anesthesia. This is more than enough about herbal remedies.